I'm Raj with SickBay. SickBay collects and delivers physiologic data at scale. My team talks to clinicians, researchers, and quality folks to understand how they are using this novel data set. Today, my colleague Mishan and I are excited to be joined by Dr. Lindsey Knake. Dr. Knake is a neonatologist and an Associate Chief Information Officer at the University of Iowa. She's here to chat with us a little bit about how she's been using SickBay. Thank you for joining us.
Thank you guys for inviting me. You already told everybody I'm a data nerd by all the titles I have. But for people who don't know me, I have a background in biomedical engineering before I went into medicine. And that's why I think I really love neonatology, all the tiny babies, all the data, all the math. And I'm really excited to talk because SickBay gives me exactly what I love and all that granular second by second data so we can really dig into the analyses for our patients.
It's so great to connect with you because we've known you here at MIC as just this great super user of SickBay, and just talk to us a little bit about how you use SickBay in your daily care.
Yeah. So my research interest is actually specifically into neonatal mechanical ventilation. So with that engineering background, I think I've always been fascinated about how we have machines and tools that have really advanced our care of neonatology and allowed us to keep younger and younger babies alive as our ventilators and the technology of our ventilators has gotten better and better. But I feel like a lot of clinicians, don't maybe understand it or follow the data as much as somebody like me who loves looking at all the data really can. So my favorite use of SickBay is the fact that I get, second by second ventilator data that I can look at in my office so that I can check in and how is this sick patient doing? What can we, fine tune? How can we make, the blood gases and things looks better for our patients?
So, this is what's so fascinating to me. We're using all of this multimodal data, and you talked about keeping younger and younger babies alive. So, what do you think has happened over time that's able to do that specifically? Because, the technology is getting better, the ventilations systems are getting better, the monitoring systems are getting better. How does SickBay fit into all of that?
I think it really helps us even learn more about the physiology of our patients. It's because it's a whole package in us doing a better job of understanding ventilation of our patients, but also understanding their hemodynamics and when are they getting sick and when can we intervene, when can we give them antibiotics or medications. So I think it really helps in that personalized medicine and that second to second monitoring that these really sick and tiny premature babies need for us to keep them alive, because it's that first 36 hours for the extremely premature babies that I think is most crucial for us to do the right management and medications that they kind of, in neonatology, we talk about them declaring themselves on if they're going to be able to survive or not.
Wow. That is, it's amazing work. So then talk to us a little bit about, the difference between, okay, I have EHR as a tool, plus I have my monitoring systems as a tool versus having SickBay as a tool as that first front end for care decisions.
Yeah. So as an associate chief health information officer at Iowa, or one of our ACHIOs, I work with our EHR a lot as well. And I've taken all the extra classes, and I'm a big proponent of what we can do in the EHR and improving our EHR. But there are limitations. We're lucky at Iowa that we have some of the unvalidated device data in our EHR. So we can see some of that for a limited amount of time. But not many places have that, and not a lot of people even in Iowa know that that exists. Me being the data nerd, of course I know it exists, but that's still, every 5-minute data. But if I want to help supervise a fellow and be up in my office and let them try to manage the patients, I can see second by second data of what's happening on the ventilator, in the heart rate, what's their waveform in my office, so that my fellow can ask me a question and I can, trust but verify what they're doing, watching what our patient's seeing. So that's where the power, I think, of SickBay is really useful, not only in reviewing in the past that second by second data, what decision did we make? Was it the right one? Did their blood pressure respond? But also see in real time, is this patient still doing okay? Or do I need to get down to the unit now? And sometimes I love it when I have sick bay up at my office and then I get a message from my fellow that says, I need help. And I can immediately see, oh, that's a patient they need help with. I will be there. So,
wow. Yeah. Right. Oh, that's such good information to have, because otherwise you don't know if you need to stop what you're doing right that second and run and go support. So tell us what you're working on next. Anything big coming up for you next?
Well, I can tell you my 10-year plan, my future vision. What I'm working with sick bay data on is I someday want us to get to be able to have an extubation prediction model for our neonates. So once we're able to keep them alive, how do we know when is the right time to get them off the ventilator to try to prevent chronic lung disease, all the other bad things? We know we need the ventilator to keep them alive, but when can we get them off to prevent those long-term complications and improve their quality of life in the future? And as clinicians, we do our best guess, but we still get it wrong. And that 20 to 30% of the time they have to be reintubated and it wasn't the right time. And that's where I think continuous vital sign data will really help us. What is it in their heart rate? What is it in their pulse ox and how frequently they desaturate? What are those signals that me as a human, I can't pick up because I can't understand the small micro changes over time, but maybe a computer algorithm could help me predict now is the time that this patient is ready, or this patient actually is maybe starting to get more unstable and more sick. Let's wait a few days to see if they can stabilize out.
Well, we're always really excited to support you in that kind of work. And we know just together, we're going to make changes for all parents, all babies, really any life form that really needs that support and care. That's really what sick bay is all about, is really making sure that we're there to be that tool to advance that care long term. Thank you so much, Raj.
Yeah, what struck me about what you were saying, having more eyes on the patient helps both the patient and your team. As a leader of these physicians, you want to be everywhere that you're needed as soon as you can be there, right? And I think that's a really important part to both support the patients that you're caring for, especially in this first 36 hours of life, and your team caring for them. I think that's just a great, for us to be able to support like that is very inspiring, and I appreciate that point of view, that sick bay can maybe help with that.
And I've been so thankful for the partnership you guys have had with us, because it's funny, like even the updates since I've been using sick bay, the fact that we could have like automated views that I look at these, monitor, these signals all the time. And now I have an automated view that I can share with my fellows and I can pull up so quickly. And, what that is great for us as researchers is I make the best view that I think is useful, and then I can teach my fellows how to use it. And like looking at them and say, look, this is how I review the apneas of the patients, and these are the good signals to look at to see is this true apnea or not. This is how I'm troubleshooting a ventilator by looking at the retrospective ventilator data and being able to teach and share with them how I'm thinking about it as well.
I love that, right? The flexibility when you have time to make it the way you need, and then when time is at a premium, do it this way. We've tested it out; it works. That's a really great flow. If you out there would like to learn more about sick bay, or if you would like to come on and talk to us about how you use sick bay, please drop Michonne or I a line. We'd love to hear from you. Until then, thank you, Dr. Knake. Everyone out there, please take care, and we'll see you next time.